Welcome to Perspectives in Business. I am your host, Juan Carlos Giraldo, from Boston, United States. In this episode, we will explore hospitals, healthcare, and sustainability. Today, my guest is Dr. Jonathan Slutzman. Dr. Slutzman is the director of the Center for the Environment and Health and medical director for environmental sustainability at Massachusetts General Hospital here in Boston. We discuss this critical topic and also the significant sustainability initiative that the Mass General Hospital is leading toward a greener future for the good of patients, society, and the planet. Hello, Dr. Slutzman. How are you?
I'm doing well today. How are you, Juan Carlos?
I am doing well. I am so happy to have you today as a guest in my podcast. Today, we will discuss about hospitals, climate change, and sustainability, which is a very, very interesting topic. I would like to split this conversation, Dr. Slutzman, in three parts. The first, we will explore the context of the hospitals, health, and climate change. The second part will be focused on hospitals and sustainability. And the third part will focus on the work of the Center for Environment and Health at Massachusetts General Hospital, where you are the director. I would like to start this conversation by asking you, are human health and the health of the planet connected?
Unquestionably, yes. Perhaps you could see it as a leading question, but it's most certainly yes, right? Everything that goes into us, organisms, humans as well as animals and plants, it all comes from the natural environment. And all of the atoms and molecules and compounds that make us up have to come from the natural environment. The Earth is a mostly closed system when it comes to these items. So how we are built, how we grow, how we interact are all governed by the natural environment, which over the course of millennia has certainly changed. It couldn't be more of an interdependency than what it actually is. It's truly amazing that everything has evolved to work in conjunction with each other. That's the whole concept of an ecosystem that we depend on each other. And so, yes, it's everything about our beings and health ultimately comes from the natural environment.
Certainly. Thank you for your response, Doctor. While I was preparing for and studying for this conversation, I saw your presentation online titled How Medical Centers Can Lead on Environmental Sustainability. And you mentioned that healthcare is responsible for the 10% of greenhouse gas emissions just in the US. So my question is, why should a hospital care about climate change, emissions, and global warming?
We in healthcare, and that number, it's just under 10% of US greenhouse gas emissions come from the healthcare sector. We in healthcare have a moral imperative. Our entire mission is protecting human health. Our job is to take care of patients. And I worked last night clinically in the emergency department at Mass General and took care of many patients. That's our mission. That's why we exist. We are here to serve to improve human health. Climate and other forms of environmental pollution are harming human health. So that 8.5% number is remarkable simply because it's counter to our explicit mission. If we in healthcare were going around spreading carcinogens or poisoning food or injecting infectious material into people on the street, people would be rightfully outraged. That is essentially what we're doing by polluting through our climate change emissions, greenhouse gases, and through other pollutants. The scale is obviously different to some degree, but we are contributing to the problem. When we know that pollutants in the form of particulate matter or nitrogen oxides or sulfur oxides or greenhouse gases, carbon dioxide, nitrous oxide, and so on, we know with very good science that these pollutants harm people downstream, who then need to come back to us. The clearest example is we know that on days when air quality is worse, we see more people coming to hospitals with asthma exacerbations or exacerbations of chronic obstructive pulmonary disease. I've seen these people. We know it happens more, and climate change makes it worse. So we are part of the problem when we explicitly should be part of the solution.
It's interesting that you mentioned air quality and pollution. Water, for example, also is another element that is often a risk from this pollution, right? So, Dr. Slutzman, let's move on to the second part of the conversation and delve into the hospitals and sustainability. Many people are unaware or probably do not understand the relationship between sustainability, healthcare, and hospitals. Hospitals are like let's see, small cities, right? Where there is everything, with energy consumption perhaps being the most notorious. So my question is, how do you define sustainability in healthcare, particularly in a hospital?
So I define sustainability in healthcare the same as I would define sustainability in any other aspect of life, and it's the idea that we are meeting our current generation's needs without harming future generations' ability to do the same for themselves. Uh, in healthcare, you're right. We are small cities. There are 27,000 or so employees at Mass General Hospital. We just one little tidbit. Our hospital is the busiest commercial kitchen in the Commonwealth of Massachusetts. We serve
Yes.
30,000 meals a day, which is
Unbelievable.
unbelievable. It's a huge number, right? So there are a lot of things that happen. We have to be open every hour of every day, all year, every year,
24/7.
24/7, 365. And we have to do so regardless of the conditions outside. So we need to be able to operate during unprecedented storms or heat waves or floods or anything that you can throw at us. We have to be there. We are an anchor institution, and we need to be there when people need us. The result is that we need to be resilient and prepared. We have exceptionally high energy needs. You referred to that. Totally true. Healthcare is the second most energy intensive commercial building type in the United States, second only to food service. So we have a responsibility to meet all of these needs in the most sustainable way possible. And for many things, the technology exists for us to do better. And we are always striving to do better. I think that we at MGH do pretty well. But again, always room for improvement. And we are continually striving to improve. And we can do things like sourcing our electricity from renewable generators. We can build a new building,
Correct.
which we are currently doing, that will source 85% of its energy from renewables, and the other 15% comes from byproduct steam at a cogeneration plant, with a pathway to make that steam from
Oh, that's
renewable
amazing.
energy as well over time. So we can design things like that with heat pump technology and other energy recovery technology and better insulation and building envelope technology and so on. So that's part of our responsibility. We also have an ability in healthcare, somewhat uniquely, that we can change the way that we practice to be more sustainable. And what I'm talking about is
Mm.
that up until the early 1990s, healthcare, I would say, got a pass when it came to financial costs. And I think in the last 5 years or so, we're seeing much more of a movement for healthcare to stop getting a pass when it comes to environmental costs. We provide a lot of
Mhm.
care that is, for lack of a better term, lower value. It might not provide the health benefits that we really think that our patients deserve, and just isn't worth the ill effects to the patient, to the environment, to the health system, and so on. Um, well, it turns out that a lot of the work on right sizing care up until now has really focused on financial costs. We can take the same kind of thinking and apply it to environmental costs and say, Well, should we be doing MRIs for everybody who has lower back pain when we know, number one, it costs a lot of money, and number
Yes,
two, MRIs actually have a
of
pretty
course.
big environmental impact, primarily driven by the energy required, but also because of the infrastructure required. So there are multiple reasons that we can do that. We recognize that some of this lower value care results in downstream cascades of additional care that might not actually provide benefit to patients. The classic example, I think, is a patient gets an electrocardiogram, an EKG, for screening purposes or because of a pre op evaluation, and the EKG shows something that's not perfectly normal. So then they get another test, and that shows something that maybe isn't perfectly normal. So then they get another test, and so on and so on. And ultimately, it changes the patient's health not at all, because it turns out you found something that was completely incidental and irrelevant and was never going to cause harm to the patient. Um, and all of that comes along with costs, environmental and financial. So we think about those things, and we are trying to build a scientific evidence base to help healthcare practitioners, doctors, nurses, and so on, to take better care of people, and to identify the things that we should be doing more and the things that we should probably be doing less. So I think that's all part of healthcare sustainability. So a lot of it is infrastructure improvements, that
Mhm.
kind of energy as the big one, but other things as well. But and then a good deal is the clinical care delivery. How can we do that better?
It makes sense because an MRI is energy intensive, right? I'm not a doctor, but maybe it's better just to prescribe 10 sessions of PT to resolve the lower back pain, right? So again, I'm not a doctor, but I'm thinking.
It's a great question of what the differential environmental impacts would be. It's a question we can answer. And then you get into other questions for the 10 sessions of PT. Is it located in a place that is efficient from a transportation perspective? Is it close to your home? Can you walk there? Can you take public transit or mass transit? Is it possible that some of your PT sessions could reasonably be done through telemedicine, where the transportation impacts for the most part go away? And I pick on transportation because if you look at the data, when it comes to outpatient healthcare, transportation becomes usually the biggest or one of the biggest environmental impacts. So let's optimize everything as much as we can.
Exactly, it's a good point. Now, if we talk about all these situations, what are the main challenges to implementing sustainability in hospitals?
There are a lot of challenges. We have a lot of competing interests. What is our overriding number one focus? And that's taking good care of patients clinically. Everything has to start there, whether it's financial concerns or environmental concerns or anything else. Number one has to be, how can I take the best care of the patients in front of me? So some of those competing interests might be, how can we make sure that patients who live in more spread out areas can get the care they need? I'm not going to tell people who live in northern New Hampshire, no, you can't come here to get your care. It's too far. It's too many emissions, too much pollution to drive down here. No, you need your care. You should get it at the most appropriate facility. And sometimes that's going to be in Boston. But we can talk about, how can we build a health system that meets that need in the best way possible.
Mhm.
Another thing is, we need to be cognizant of infection control. So we in healthcare, we certainly don't want our patients to come to us in the hospital and walk out with an infection, or worse, not walk out because of an infection that could have been prevented, that was transmitted from the care that we delivered. So we need to balance, how can we optimally prevent the transmission of illness
Mhm.
while also delivering care in a very sustainable way. My attitude, and I come to this world
Oh,
from environmental engineering. That's what I practiced before medicine. I like to think of myself still as an environmental engineer who happens to be a doctor. And I think that we have the ability to weigh those risks and benefits for each option. So let's quantify what are the risks of providing care with reusable devices versus the risks of providing care with disposable devices, and what are the benefits of each. And let's optimize so that we can provide the greatest benefit to our patients with the least risk. And sometimes that's going to be reusable devices. And sometimes, occasionally, I admit, it might be with disposable devices, even when the environmental impact is going to be greater. So those are some constraints. I mentioned the resilience constraint. We have to operate 24/7, 365. And that means that when the electricity grid goes down, we're buying renewable electricity from predominantly wind farms, but also some hydropower. When the grid goes down, we still need to operate. And that might mean using fossil fueled generators. It also means that we can look into other technologies, like is there room for hydrogen powered fuel cells
Or nuclear, perhaps?
or nuclear energy? Although the grid goes down, the grid goes down.
Exactly.
But what can we deliver at our own facility? Hydrogen powered fuel cells. We actually have some fuel cells across our health system that do some of that job. Battery backups. We know there are some facilities, newer facilities, particularly out in California, that petitioned for the building codes for hospitals to be changed to allow battery microgrids as their backup system. So there's room for that. And I think as battery technology improves, we'll see more of that. So we need to be able to operate 24/7, 365, but that doesn't mean that we can't innovate and we can't take advantage of technological developments
Mhm.
to reduce the environmental impacts.
You mentioned in this part of this answer the word patient plenty of times, and I read a very interesting article about sustainability in hospitals. And one of the outcomes of this article says in 2019, the study is 94% of patients consider a hospital's environmental sustainability program a necessity, necessary in any kind of hospitals. Next question, which is related to the patients, and it's about the Center for Environment and Health at Mass General Hospital. Can you briefly share what this exciting center is that you are leading with your other colleagues at the Mass General Hospital?
Yeah, the center is super exciting, and we are really proud to have it. We've been around for 3.5, coming up on 4 years. We are the first academic medical center based center focused on environmental sustainability and the interactions of the natural environment and human health that takes a holistic approach. We have a mission to infuse environmental thinking into all aspects of the hospital's mission, which matches the four pillars. So, number one is delivering high quality, safe, excellent clinical care in the most environmentally responsible, climate smart way. How can we improve our own operations through our infrastructure, through clinical care delivery, through any way that we can to make our operations environmentally better? Number two is research. How can we develop new knowledge on the inextricable links between the natural environment and human health in both directions? And when I say both directions, climate and health essentially has two lenses. One is what is the impact of the climate crisis and environmental pollution on human health? Super important. The other is how does healthcare contribute to that problem? And we look at both. If anything, the center is actually focused a little bit more on the latter, on how is healthcare contributing to this problem and what can we do better. And so our research pillar is really focused on that, as well as leveraging the fact that the Mass General has the largest portfolio of hospital based research in the country. We're the largest recipient of NIH funding, over $1 billion per year. So, how can we take advantage of that and infuse environmental thinking into some of the research questions that our faculty are investigating? Number three is education. And I know that you are very focused on education when it comes to climate and the environment. I agree. It's absolutely critical. Um,
It's not only sorry for the interruption, not only for the patient, it's only for the employees, for all the staff.
Exactly.
They have to understand.
Exactly. You hit it right on the head. And our educational mission we take to mean we have to teach our faculty, our attending physicians, our residents, our fellows, our trainees, our medical students, our staff, our nurses, our pharmacists, our environmental services employees who clean the rooms, everybody at the institution, and the patients and the communities in which we live. We need to teach all of these folks about these links between the natural environment and human health, both with respect to what they can do to improve their own health and how they can identify these links so that they can work to improve them either in the public sphere, or they can identify what risks they might have should climate impacts occur. For example, what do I need to do when a heat wave is coming? And we know that even here in Boston, where I first moved to Boston 23 years ago, and air conditioning was not common at all. It just wasn't common. Most homes didn't have it. The home in which I live did not have air conditioning because it just wasn't really needed. And we would run a room air conditioner maybe, 10, 15 days a year. Today, it's almost the whole summer. We at Mass General, we're currently building the Reagan building on our campus. It's going to be about 1 million square feet of predominantly clinical space. And as part of the design process, our team looked at some climate projections so that they could figure out, okay, what do we need to design this building to withstand? 10 years ago, in an average summer, Boston would see 10 days over 90 degrees. In the future, when this building is standing, we are projecting 90 days over 90 degrees, which is every day in the summer, basically. So we're seeing that, and our patients are suffering because of it. So we need to educate our patients about this so that they know what to do. And then the last pillar is public health advocacy. How can we use our trusted voice as scientists, as clinicians, as people who care about human health? How can we use that position, the power of the white coat, you could call it, to advocate in the public sphere as well as the private sphere for better policies with respect to environmental protection? And that takes the form of speaking on Beacon Hill at the Massachusetts legislature on bills. It takes the form of speaking to folks at the Boston City Hall or in Washington, which we have done as well. It takes the form of writing letters and signing on to statements. And then it also takes the form of working with our suppliers and our accreditors, the Joint Commission or pharmaceutical companies or medical device manufacturers. And we've met with all of them to say, look, we all need to do better. And we obviously live in an industrial ecosystem to be able to provide the care that we do to our patients. We can all do better and we can learn from each other. And at the same time, we as an institution, when we are purchasing things, are going to be asking you about this. And if you're not able to answer our questions, or we get to a point where you answer our questions in ways that we don't think are optimal, we're going to go with other suppliers, and we're gonna show that our dollars mean something. So we work together with other like-minded healthcare institutions as well as on our own to do some of these things. So those are our four important pillars, and we work in all of them all the time. And I have a great team of clinical leaders who are associate directors in the center, without whom I would not be able to do any of this. Yeah, those four things are key.
Dr. Slutzman, MGH is one of the best academic medical institutions in the world, and many hospitals want to emulate MGH. Let's see, for example, hospitals in South Africa, Peru, the UK, France want to implement sustainability programs. How can I start these programs? So I understand that hospitals are different and have their own reality and needs. What would you suggest to them to start their own sustainability programs?
Great question. So first, I am honored that you would even suggest that the UK would follow MGH's lead, because we greatly see ourselves as following the UK. The UK National Health Service is the world's leader in delivering sustainable healthcare and have been doing great work for a number of years. So I look up to them, and they deserve the kudos that they receive. I think every hospital or healthcare institution has the opportunity to do better from an environmental perspective. As you mentioned, and I think you're right, every place has their own constraints and environment in which they have to be working. So a hospital in Peru or South Africa or in Eastern Europe is going to be drastically different than Mass General, and that's okay. The key is they need to provide the right care for their communities. I think that there are a number of steps that any organization would need to take. The first is really building a strong group of individuals who are going to be working from the inside. And those individuals, I would say, and I am a little biased in that I am a physician, should include clinicians, but also needs to include non-clinicians. The best work that we have been able to do at MGH has been in partnership between the people working and the leaders in our non-clinical departments with clinicians who are learning and advocating as well. So I think forming a good working team of non-clinical and clinical leaders, and then figuring out, number one, what are the opportunities at any given institution? And that might take the form of an environmental inventory where you can say, okay, let's figure out what are our priorities. And maybe your priority is climate. Maybe your priority is water use if you're in a water constrained environment. Maybe your priority is resilience in that you're in an area where you're perhaps more at risk for climate related disasters. Thankfully, here in Boston, we are a bit more protected, but not completely. And we are definitely projecting increases in the future. But the reality is we are very unlikely to see a Category 5 hurricane in Boston. We will probably see a Category 3 hurricane at some point in the near future because of climate change, but not a Category 5 hurricane, whereas plenty of other places, South Florida, for example, are much greater at risk. So you have to identify what's important to you and then maybe take an inventory and say, okay, within that category, where are our hotspots? And if I'm looking at water use, is my hotspot providing hemodialysis? Is my hotspot food service? Is my hotspot central sterilization? Figure out what it is, and then work with your leaders and maybe your engineering teams to figure out what can we do differently, what can we do a
Yes.
little bit better,
Yes.
and yeah, and you start with a small thing, pick one small thing, and then you make progress, and then you evaluate that progress, and you iterate on that progress, and then you do something bigger. Uh, our Center for the Environment and Health did not arise out of thin air. It came from a place where we have been working in sustainability, predominantly focused in energy for a while, for decades. And then we built some more
So how it
clinician
start?
involvement. And then we built a committee. And then we identified what priorities would be and what our goals would be and what our objectives would be. And then over time, we got to a point where, okay, it's time to build a center and really execute that way. And the center is not going to be the final iteration either. So I think any place can really follow that lead with the really important message. You're not going to start with the biggest. You're going to start with really grassroots partnership with leadership to identify smaller things first and build from there.
That's true. Dr. Slutzman, before wrapping up, I don't know if you would like to add something to the audience, like what the Center for our Environment and Health offer to the patients, doctors, employees, the community in general. Because, for example, I read plenty of the reports and I am amazed. Like, for example, they are working in composting for the waste food is 100% renewable energy. Plastic, they are working, targeting the plastic. I don't know if you would like to add something, how any kind of resources for the community in general.
So I would say that our community should recognize that we are doing better than we have been and that we know that we can continue to improve.
Mhm.
We would love to hear from our community members about what's important to them. I think that we in healthcare, especially, need to be in partnership with our community to meet their needs in the best way that we can. So the more that we hear from our community about what would help them to live better, healthier, happier lives, the more we want to do that.
Exactly.
I think beyond that, I would say we are thrilled to be able to show our community and our staff that we are doing what we think to be the right thing. And we know that our employees want to see it, they want to be a part of it. It gets them up in the morning. It makes them feel better about working for an institution that cares about the natural environment
Mhm.
and the climate crisis. And so I'm thrilled every day to be able to do this work.
Dr. Slutzman, where people can contact you? I know the web page is fantastic, but please share with the audience because I pretty much the whole conversation that I having with you right now is because I study the whole web page and the resources are amazing. Endless webinars, podcasts, articles, guest lectures, writing some kind of papers that are amazing, and it's very, very useful.
Yeah, thank you so much, Juan Carlos. It's great to hear that. We put a lot of effort into our work, and it's great to hear that folks appreciate it. Anybody in the community is welcome to reach out to our center. Our email address is ceh@mgh.harvard.edu. We'd love to hear from the community, as I said, and you could do a web search for Mass General Center for the Environment and Health, and we should be right at the top of the list. So feel free to take a look.
Dr. Slutzman, I would like to say thank you for your time.
Absolutely, my pleasure. Thank you so much for the opportunity and the invitation.
Thank you so much. I'm Juan Carlos Giraldo from Boston, United States. Thank you so much, everyone. The views, information, or opinions expressed in this episode are my own and do not represent my employer's views.